Hello, my name is Rachel Kelly, and my topic for this discussion post is urolithiasis. Well, to begin, urolithiasis is kidney stones. It's calculi present in your urinary tract. Renal calculi can form anywhere. It's mostly commonly found in the renal pelvis and calyces of the kidney. There are different names for different stones depending on where they are formed. For instance, nephrolithiasis, as you would refer to the stones that form in the renal pelvis and calyces. The nephrolithiasis is formation of the stones within the kidney. There's 4 different types of stones: calcium, uric acid, struvite, and crystine. These are determined or identified by what they are composed of. So calcium stones are composed of calcium. Certain stones have certain characteristics, different shapes, different interventions per stone. This is going to be a general overview. The formations of the stones are caused by 2 different conditions. The first being supersaturation of the urine with the particular element. For instance, calcium stones, that would be calcium. That crystallizes and becomes the actual stone. And then the formation of nidus, which is a crystal deposit along the lining of the kidney and urinary tract. These stones can often cause no symptoms until they pass into the lower urinary tract, and that's when the symptoms become described as unbearable, the ones that you associate with kidney stones. So dehydration is a common factor, so patients that undergo ureasis are at risk. Here is an illustration I made describing different locations of different stones within the urinary tract and how they would be referred to. The ones that were the ones that are most common are the pelvic stone and the calcium, as illustrated within the left kidney of this client. So for a patient with urolithiasis, the nursing assessment is going to always include an assessment for pain. Renal colic, the severe pain associated with kidney stones, is the major symptom of urolithiasis. So the pain's location indicates where the stone is present in the urinary tract. For instance, flank pain indicates that the stone is present in the kidney, and as it descends from the flank towards the lower back, it marks the progression of the stone through the urinary tract. So you're going to do a full pain assessment, which is the 0 through 10. You're going to be assessing for guarding behaviors, lack of sleep, facial masking, all things that are associated with nonverbal pain. You're also going to be looking for the autonomic responses to pain, so elevated vitals. And you're going to want to be sure to identify vitals that indicate infection as opposed to pain. So an elevated temperature and pulse could be a symptom of infection, which could be caused by struvite stones. So you're also going to observe for nausea, vomiting, pallor, diaphoresis. This could be associated with pain. It also could be a GI affect. Bladder distension or reports of bladder fullness would indicate urinary retention, so that's going to be important because that would be indicative of obstruction. So observe for mental status changes. This would be related to an accumulation of waste or electrolyte imbalances, which is related to the kidneys and fluid status of our patient. You're going to check the lab studies, elevated BUN, creatinine, electrolytes, all related to kidney function, and a urine analysis. This can let you know what type of element is becoming saturated in the urine. It can determine a UTI, and also can determine how the kidneys are functioning and what the specific issues the kidney stone is causing to the urinary tract. For instance, high WCs in the urine would indicate infection. So common diagnosis for urolithiasis is acute pain, impaired urinary elimination, risk for infection, and deficit fluid volume. The nursing care plan would be to relieve the pain and discomfort in acute systems. You're going to want to monitor urinary elimination for retention or obstruction. You're going to monitor vitals and lab work for signs of infection or pain, and that could also be applied for pain, and promote frequent hydration to ease the passing of the stone. Implementation of these plans would include assessing and monitoring the vitals. You're going to once again be looking for fever, and pain is going to be the major symptom of urolithiasis in its acute state. So continually assess. When you're going to want to address the pain, you're going to have drug therapy options. Opioids are the DOC for this condition. Certain NSAIDs may be effective depending on the phase. You're going to provide comfort measures that are non-medication based, so back rubs if that's indicated. Restful environment always promotes relaxation. Focused breathing and guided imagery might be options. Lithoplasty might be a plan implemented by the provider, and in a lithotripsy, this is the use of sound, laser, dry shock as a sonar to break up the stone into small fragments. So you're going to be straining the urine. When you do eyes and nose, you will be straining all the urine to monitor the passage of the stone. For independent patients, they can do this on their own if educated to do so correctly. You're going to be doing eyes and nose, characteristics of the urine, daily weights. All of this is going to be documented. Administering the medications as prescribed, so this would be perhaps antiemetics related to nausea, antibiotics related to infection, and obviously the pain meds. And you're going to promote fluid intake to 3 to 4 liters a day. Dehydration is a common factor, and one of our nursing diagnosis is a deficit in fluid volume. So we also have to now evaluate how our interventions have been effective. Our client is relieved of pain and discomfort, reporting a 0 out of 10 pain scale by the end of shift. This could just be by medication. Perhaps they passed the stone, but that's the evaluated goal being successful. The client shows no signs of infections through vitals or lab work. You're going to also maintain fluid balance. This will be evidenced by vital signs and the weight within the normal range. You're going to feel peripheral pulses, mucous membranes will be moist, good skin turgor, no indications of dehydration, essentially. Electrolyte status will be normal, no normal I's and O's. So this will also indicate that there's been no urinary retention. And that will be our last. Client shows no signs of urinary retention or obstruction. And this will be evidenced by urine output and no bladder distension throughout the shift. So that is my nursing care plan for urolithiasis for my discussion post. Thank you very much.